Good afternoon, and welcome to the May 22nd Committee of the Whole meeting. Wow, May 22nd already. Holy. The City of Parksville recognizes the people of the Coast Salish Nations and their traditional territory upon which we gather with gratitude. We have our first delegation, and it's the Perfect Storm Group. Tom?
Okay. Thank you very much, Mr. Mayor and councilors, for inviting the Perfect Storm Group to do a presentation to you today on this significantly important topic. And I'm Tom Davies, and I represent the Perfect Storm Group. And who are we? We're a group of advocators for ways and means to improve the delivery of health care in Oceanside. We've been around for a long time, and sometimes different name, but this name here now is the Perfect Storm. And our group is made up of the mayor's RDN folks, Oceanside Division of Family Practice, Island Health, Chambers of Commerce, and service clubs who are community leaders who have all over the past 10 years under different names have been advocates of delivery of better health services in Oceanside. And the Oceanside Health Center is one example of the kind of work that the public the community was able to pull itself together and advocate for something like the Oceanside Health Center. And we all know what kind of a success story that is. But in the meantime, we have a critical problem right now. The doctors' shortage is critical. And currently we have 68,000 residents, what we call orphan patients, who have no practitioner here. And when that boils out to about between 5 and 6 doctors that would handle that kind of a number. So if we were able to hire 6 doctors today, the problem that we have is there's no place to house them. And the Perfect Storm Group has been advocating for team-based primary care, where doctors who've told us very clearly over the 3.5 years that we've been calling ourselves the Perfect Storm Group, that what they want to do is they want to come here, work as doctors, and at the end of the day, they want to have a life. They don't want to be spending up to 1 o'clock in the morning doing their book work and making sure all the staff problems are resolved and the tongue depressors are all in order and that sort of stuff. So it is a critical problem, and it's very difficult for anybody to recruit doctors into any area that doesn't provide the opportunity for new doctors wanting a balanced life so they can bring their families here. Unfortunately, the way it is right today, there isn't anyone in this room can tell any new home purchaser here that they have any hope of getting a family doctor anytime soon. It's going to be impossible for that, and that's why it is a critical storm. And so we need to keep focused on what's going to attract doctors and their families to an area like this. And it's not just a matter of getting doctors here. The doctors have their own other needs as well. Oftentimes they'll have spouses that are professionals and they need to look for employment that is compensate with their skills and training. They want schools to be high enough quality that their children, because they're successful people, can come here and graduate from high school with a good education. And I take comfort in the fact that the local newspapers lately have shown a number of projects that teenagers in high school have come up with, scientific projects, that type of thing. So there's no concern that I would have about the quality of education in District 69. There's simply not enough doctors to go around. and all be bones and dust and ashes before there's any hope that we'll have enough doctors to service any of the areas completely and fully in British Columbia. It wasn't that long ago that there was 46 postings up for doctors on Vancouver Island, and they're just not being filled. There is also, but it's not just the doctors, there's also folks like the nurses and the nurse practitioners and the physiotherapists and the lab techs. Those kinds of health-related professions are hurting as well. And so, but it all centers around the doctor. And everybody wants to have their family physician, and even some of the millennials say, hey, listen, I'll go, I don't need a doctor, I'll just do it myself, and we'll still be looking after things like the services they provide at the Oceanside Health Center. And we also know, too, that with the advocacy of nurse practitioners, and they have certainly outdid themselves by showing how great they are by handling all the primary care for the last few years over the Oceanside Health Center. And they do a great job, and they can do the bulk of the doctor's work, and they can carry a patient load on their own. And there is a program that the government has put together, and you've all probably all read it at one point or another, that 200 nurse practitioners will, as long as you take new patients, will get a guaranteed salary over a 3-year period, increasing, and they will also have the ability to open their own practices and practice medicine, do prescriptions, all that sort of stuff. And they, as I say, they've already established their credibility. When so that's what the challenge is. We don't have enough docs. We're not going to get enough docs. We do have some solutions, and part of the solutions are using nurse practitioners to do the medical primary care work, as well as getting our hands on as many doctors as we can as well. But the real solution comes from the community owning and operating and running a wellness facility, a primary care wellness facility. I think we'd be naive to the extreme to think that the government is going to be flying in here on some sort of a white horse and dropping millions of dollars onto the community and say, okay, here's the building for you, make it work. The only way this is going to be work is if the community is aware of how serious the problem is, and are they willing to put enough skin in the game that they will pony up and say, we support this. And there's all kinds of ways to support it, whether it be something with the councils or whatever, or fundraising, who knows. One thing I do know, and Mr. Mayor, you and Councillor Frass and PSG talked about that about a month or so ago, that we need to be looking at a needs analysis to find out exactly what it is that we need to have done here. And that would probably be, from what we understand, be about a $30,000 touch to do that. And so if we can, the Oceanside Health Center is a fantastic facility, but it also teaches us some lessons as well. That facility has been operating for 5 years, and it's chock-a-block full. And so that means that we need to develop something that is long-term, sustainable, and that we're not coming through these kind of exercises every 5 years. And it is achievable to have a community-owned, operated wellness facility if the community is willing to pull together and make it their priority to get this done, because nobody else is going to do it. And every segment of Oceanside will need to band together to collaboratively and collectively ensure the long-term sustainability, sustainable delivery of quality health services. And the call to action, I suppose, is that if we hope to establish long-term sustainable top-quality health care for everyone in Oceanside, plus the hundreds of thousands of visitors who come and visit us each year, it is up to us and no one else. And so I will leave you with that thought, and I hope that the call to action will create some stimulation in the community that if this is our problem, we have to own it. We have to own it. And we know that the councils are very serious about this. You've done your roundtable, mayor's roundtable, and you've come up with the health care and others issues are significantly important. And, I just can't imagine, moving several thousand more people into this area and having to tell each and every one of them, you want a doctor? Sorry, forget it, try someplace else. And I know for now there's just a very, very small opening there where some folks are going up to Comox because some of the doctors are accepting patients up there. But the reality is that we should be able to provide proper medical services in the Oceanside area, in Parksville, Qualcomm, RDN, up north, down south, and so on. So on that point, I will ask that you consider seriously the opportunities and the challenges that we have ahead. And if there's any questions, I'd be very happy to answer them.
Thank you. Thank you very much, Tom. Okay. I appreciate it. Are there any questions at this point in time? I think what we're going to do is let's go through your presentation, and then maybe we can open it up for some questions at that time. That way we've got a bigger conversation piece, if you would. All right?
Thank you very much.
No, thank you very much. I appreciate your time and effort. Okay. Mrs. Kaler. Would you please give us a background on the issue regarding council actions to address doctor shortages?
Thank you, Your Worship. So in this staff report, as this is an item that doesn't very clearly fall into the local government jurisdiction, but it is one that local governments can influence, and also one that, as the presenter there mentioned, can support in other ways. What I did in this report was look into what the Ministry of Health and the provincial government is doing to address this issue. It is an issue in almost every community in BC, and I think there's certainly a lot of work being done at the provincial level, but I think partnerships and looking at local solutions is probably one of the ways that a community is going to achieve some success. So the report just outlines some of the steps that the province are taking, but of course a lot of them will take many years, I think, before there's an on-the-ground result. So some of the items that Council actually discussed earlier were providing indirect or in-kind support through continuing to lobby those that have the decision-making power at the provincial level. And there will be some reports coming forward for Council with respect to what you want to discuss at UBCM, which is the Union of BC Municipalities that takes place in September. There's also a number of items that could be considered, such as looking for facilities, city land or city facilities that could be offered for housing medical practitioners or their supports. And as the presenter, Mr. Davies, mentioned, looking at supporting, whether it be regionally or through the city's budget itself, looking at supporting studies and gap analysis to identify specific courses of action. Recommendations at this point are just to receive for information.
Need a motion to receive. Councillor Patterson, seconded by Councillor Greer. All those in favor? Thank you. It is a very perplexing problem, isn't it, with all of this? Again, it's a very prime example of downloading from the provincial government failing to do their job, and so it gets dropped onto the laps of the municipalities, those that are least likely able to support the issue. There's a number of things. Perfect Storm has done a really good job of looking at all the issues. TELUS Health has a new program that's been set up. I looked into it. It's an app, and what you do is you set up an appointment, and a nurse practitioner comes to your house, and then you, I would assume, Skype or something very similar to that to a doctor. There's 3 doctors on the island that are in this system, one in Courtenay, one in Comox, and one, I can't remember now, somewhere down island towards Duncan, that will take your call on an appointment basis. And then the nurse practitioner will put you through blood pressure and all the tests that the doctor needs, and then can prescribe medicines. They can do order, x-rays and all the other things that go along. Anything just about you can get done in a doctor's office. Seems very impersonal to me to be able to do that over a Skype, but I mean it may be where we're heading. I'll get to the questions in a second, but I've been working on this one for a while. There's private groups that have that do exactly what Tom was suggesting, where they put together clinics, doctors, and it's a public system. It's not other than the groups, the private groups fund all the equipment. They provide the nurses. They provide the bookkeeping, everything. So the doctor comes in the morning with his little lunch pail, comes in, sits down, or she sits down, does her work, dictates everything that's going on throughout the day, and then at 5 o'clock picks up their lunch pail, and just as Tom suggested, they go home to their life, and that's it. They don't have any expenses for equipment or anything. Seems like a very good system. I haven't seen a lot of success on it. There was a couple in Vancouver. I know for a fact one of them is closed down for whatever reason, I don't know. But that type of thing maybe need work. I think what we can do in the city is can we find a place to put one of these clinics in, and can we find a place that can be done so that the whole package can be put together, so we can attract these doctors that are just coming out of university, that are hundreds of thousands of dollars in debt, and they don't want to incur the expenses of going back to further in debt to buy equipment and set up their own clinics. So anyways, that's my preamble to all of that. Sorry for being wordy. Any questions for our delegation or anybody else? Councillor Greer, then Councillor Patterson.
Thank you, Your Worship, and thanks, Tom, for coming. And I understand where you're coming from, and I understand the situation that the mayor is talking about. But I was just looking at the core problem. This is a problem right across Canada, and we can blame it on the provincial government or the federal government, but what about the universities? Why aren't they producing more doctors? And also maybe the insurance companies have something to do with this? Doctors are afraid of their life now being sued, and we're not producing, obviously, enough doctors. So I think you have to start with the core situation, and that is we need more doctors in general right across the country. Maybe you can answer that.
Could I just offer Dr. Jim Davies is here today. Yeah, and he's certainly very skilled and wise in these kinds of things, and I think he can answer some of Councillor Greer's observations. The University of BC Medical School. UBC Medical School, where I was a faculty member, has increased its enrollment up to about 270. When I was there, it was 60. And then, thanks to Gordon Campbell, actually, the enrollment started to increase and has increased to that many. And in order to capture students who maybe were had less opportunity to get into medical school, the medical school is now distributed. So there's a bunch of students in Prince George, some in Victoria, and some in Kelowna. The Prince George one is really successful because rural students got to go to medical school where they grew up, and many of them have stayed. And there's a lesson there for small communities like ours. The whole problem is not going to be solved by creating more and more doctors. There has to be also an increase in nurse practitioners and nurses and other professionals. That's been recognized, I think, universally now. That's why this team approach has evolved as a solution. I was just at University of Victoria a couple of weeks ago talking to the head of nursing. She was telling me that the government pays, by the way, for all of the students to get taught. And it has just increased the funding for nurse practitioners in Prince George and in Victoria. So they're going from 20 to 30. So they're busy cranking out more
to try and form these teams, and they are also funding a special program to get some physicians and nurse practitioners off. The physicians are on fee-for-service, but in this program they would be on a contractual basis, and they have 200 positions for new physicians on a contract basis to move into this team-based practice in various places in the province. And we are, the division here is participating in that process. So there are solutions on hand. The usual sense is that, oh, we just need more doctors. I mean, that's what a lot of people and a lot of our residents say, because that's been where we've gotten most of our health care. But it's changing now. The physicians coming out of school and the nurse practitioners and nurses now are looking at a team-based practice. It's much more efficient in dealing with primary care, especially our population of seniors with a lot of chronic disease. So that's where it's going, and thankfully it's beginning to roll more quickly now. Even the BC Doctors organization is acknowledging that they have to get on the new page of team-based care and move progressively off of the fee-for-service onto a contractual or capitation or some other method of payment. That help?
If I could just, Councillor Greer, on your point too, that we're in the same position as lots of people in BC. We certainly are, and it's across Canada. But the ones that seem to have the most success are the smart ones that say, okay, I guess we have to roll up our sleeves and make something happen here. And it's a tough pill to swallow, and it's a tough pill for me, being an advocate for so many years and being involved in the Oceanside Health Center thing too, to come and say, why is it that we local taxpayers have to be thinking about funding such a proposition? Well, that's because the offloading is done, and some of the feedback that we're getting back is that there's a perception, mistaken, that because we have the Oceanside Health Center, because we have the palliative care, because we have the number of doctors that we do, that we're considered more to be a have area than a have not. So then when they put us up against communities who have absolutely nothing, and they see that we have something, at least we have something. So if the shift seems to be to go to the people who are very, very underserved. We are still underserved. We don't want to forget that. And, you know, there's mistakes made, I suppose, because they cut off the number of graduates from colleges just the same as they cut off the number of apprentice opportunities for tradesmen as well over the years. And in each of those cases, the communities pay the price for that.
Thanks, Tom, for your presentation. So when we talk about Oceanside, we're made up of other regional, Qualicum Beach and regional districts and everything. So are we your first conversation before a council?
No.
In this term of office, I suppose you'd say?
No, this issue, the healthcare, delivery of healthcare services, has been an issue all through the campaign for the last election, and Qualicum Beach is no different than that, and as you folks are. And we know it's a high priority for everybody, and I think that's a good thing, because it says that the two major communities are on the same page, and they recognize what the problem is, and can we work together in a cooperative, collaborative way ourselves to try to solve this problem. The problem's either going to be solved or it's not, and if we're going to solve it, we do it right and we do it once. And that's going to take some consultation, some consideration, and some folks really rolling up their sleeves and getting at it. And I don't think it needs to take a long time, because we all know what the problem is, and I think we have a broad base of what the solutions are. But when you get down to the ideal of, okay, what is the most suitable combination of delivery of health services in Oceanside that will help us to be sustainable, long-term, delivery of top quality medical services, because we don't deserve any less. And when you're talking about things like telephone, the telepsychiatry, telehealth, people at their homes having their own things put on their computer screens, identified only with them, medical records. All that stuff is going to take place, but it still doesn't negate the fact that we've got 6,000 people here, 68,000 people here that are without a doctor, plus the thousands that we're building houses in this Oceanside community for, and we need to keep that factor in mind as well.
So I understand that really well. So I'll just give brief history. My husband doesn't have a doctor.
Mm-hmm.
He retired 3 years ago, has not found is on a wait list. I'm diabetic. My specialist and everything is out of Victoria, so I go to Nanaimo and I have that video conversation, that chat, and
Yep.
he goes through my paperwork and my test results and everything that I can have done here at Oceanside Health Center. But my specialist is out of Victoria, and I go to Nanaimo and have that video chat. So I'm really well aware of our shortages and what we're looking for. So in the you haven't really done an ask, but I would hope that in our future, very short-term future and everything, that councils can get together, Parksville and Qualicum Beach, and work towards whether we start with the needs analysis, that's my personal thought and everything, or where we go forward. But I've been on this council a long time, and Mayor Main and Councillor Greer were here a while back when we did the Oceanside Health Center, and you just have to prioritize, and I think it's time that we get back to working on some of our priorities, and we know with the Mayor's Roundtable that healthcare is definitely one of them.
No, I couldn't agree with you more. And one of the things that oftentimes gets missed when you have a problem like this that needs fixing, there's also the possibility of an opportunity for economic growth as well. Because in this kind of an area here, the primary industries are not booming and bursting like they had in the past. So what do we go to? We go to the softer industries, whether it be computer types things, or we go to medical services. And I've known of committees that have grown and prospered simply because they make it very attractive for specialty services to come to an absolutely beautiful place like this as an economic priority as well. So it's not just having to dig right into your pockets and pulling up the pennies you're saving for your grandchildren when you pop off. That what we're looking at is the community coming in, creating another industry in here that will help it be sustainable on a long-term basis.
Thank you. I'm going to ask everybody to move it along a little quicker because we're down to like less than a half an hour and we haven't even started yet. So it is going to be interesting. Councillor O'Brien, very quickly. That wasn't meant at you, by the way. That was meant at all of us.
I'll try to keep my responses a little bit crisper.
I understand totally. And through the mayor and to Tom, thank you very much again. If I'm moving forward here, so if I'm hearing what you say, right, we need a primary care wellness facility in the area in Oceanside. Is it suitable at this time to set up a task force in between the RDN, the town of Qualicum Beach, and the city of Parksville to get together with yourselves and so forth to see if we can identify ways and means of making this happen? It has to be a collaborative effect, as you have said. And is that something that we should do right now, along with your cooperation and advice, or is this needs analysis needs to be done first before we go to that next step? What is your opinion on that?
Yeah, well, I think with the two members of the RDN here that you got as well, that there's no question that we're in a little bit of a sticky situation, because when the Oceanside Health Center got built, it started off as being a project that would be a 3P project, and all of a sudden, the rabbit was pulled out of the hat, and it had about $18 million stuck to it, and that's how that health center got built. And when the VHA took it upon themselves to say, yeah, we've known for a long time that Oceanside has been very shortchanged in their attention by the board of directors, and we've gone down as a Pacific Storm Group to the board of directors as well, and said, how can you help us? But we need to keep in mind too that the RDN covered about 40% of the cost of the Oceanside Health Center. Now, what we're a little bit concerned about, and I'm not sure why it might make a big difference, is why can't that 40% still apply to Oceanside if we have the appetite to create a primary healthcare team-based one here. So we've been advised that, hey, maybe if you're going to get that kind of money, you need to be attached in a relationship of somehow with Island Health or some government organization or whatever. But I think that's one that really needs to be taken a look at, and you don't take a no for an answer until you know it's a no.
Thank you, Your Worship. Through to Tom. Tom, thank you. It was a great presentation and good chat. One of the things that I think would be really interesting is to try to maybe get some of these group operations that are over in Vancouver or other locations to see if they want to put a satellite location here, a second location funded by something that's already successful on the mainland or somewhere elsewhere. It would just be interesting to see that as somebody that's already run a successful business like that, being able to plop one right down here, and we can make that very easy for them to do, hopefully. So,
well, we try not to leave any stone unturned. We've talked to, we got a hold of Donna Heiss, who's the owner of Wall Construction in Nanaimo, and has done vast experience in putting up health centers, and is working on one now, and I think he's going to be doing something on the expansion for Nanaimo Regional General Hospital as well. Tons and tons of experience, and Mayor Maine and the Perfect Storm Group had a chance to listen to her at one of the presentations she made to the Perfect Storm Group, and it got us thinking after that maybe we should ask her if what sort of options she may see of being a private entrepreneur coming in and wanting to do the whole thing themselves, and however the other financials are worked out, fine and dandy. But I think what it all boils down to at the end of the day is there's so many options that could be out there, and so many opportunities like the developers here, they're able to kick in some of their own resources or whatever. The community's been very good to us all, and that might be something that's worth looking at as well. But yes, your short answer to your question is yes. I should have said that to begin with. Yeah. Thank you very much.
Would you please give us a background on the issue regarding recreational opportunities in Parksville? We're changing streams now.
If I may, Your Worship, before Council's report on recreational opportunities in Parksville, in support of Council's recreational strategic priority discussion today, staff have provided a high-level inventory of recreational opportunities, infrastructure, and services Parksville currently supports. This report covers pedestrian and cycling infrastructure, just to give you an idea of what we have, special events, bookings, and the different types of special events that we book, RDN bookings, and the types of events that they book. We have Parks and Trails inventory and amenities, and that's straight out of the Parks, Trails, and Open Spaces Master Plan. There'll be a presentation in the regular council meeting on that. Our current capital investment over a 5-year period, totaling in the neighborhood of $6.1 million towards recreation. relevant studies and community engagement and partnerships that we have relating to recreation, just an inventory of those. And there's a list of other useful maps. Again, you'll see those in the Parks and Trails Open Space Master Plan a little bit later. And our recommendation for this is just for discussion, so recommendation to receive.
I need someone to move receiving. My God. And the seconder, Councillor, I'm fine. Councillor Wilson and Councillor Chandler. Thank you. It was bad, wasn't it? All those in favor? Okay. Any questions from anybody in the audience on this, or any points, comments on the recreational side? Sir, we'd love to hear from you. You gotta come up forward.
I'm a nut bar cyclist, and I've always thought that places like Victoria or some places in Europe really benefit not only on the health side but also on the economic side by promoting either road biking, touring biking, or mountain biking, all of which happen here and in my opinion can be enhanced, which should bring in more cycle tourists, more road bikers, mountain bikers. There's already a couple of events like Hammerfest that draws a big crowd. And down the island is Victoria, which has really been strong in the cyclist. And they probably have numbers on what the economic impact is. It would be worth, maybe you've already done this, but looking at what more could be done without breaking the bank to augment cycling for getting people out of their cars and moving around, but also for health and making more money for the community. Thanks.
Thank you. And of course, this subject ties back to the doctor situation, since most of the doctors that we're looking for are young in age, just coming out of university, and we need to be able to provide them with what appears to be an area with a lot of recreational opportunities. And I think that those are things that we need to look at, and it's no secret. I brought it up at the last meeting in Qualicum last week about, we've started to just dip our toe in a little bit about whether it's feasible to put a swimming pool in Parksville and some other recreational facilities. All of those things are important and need to be investigated so that we can draw doctors and young families into our area. So anyways, any comments from the council? Councillor Wilson.
I wanted to ask you whether or not you find it safe to bike here. How is biking for you here?
Well, I've been hit by a truck, not the same one, twice, in Parksville.
That would have been
at intersections. And some of my colleagues have been seriously injured. There's definitely an educational component both for cyclists and motorists to share the road. And communities that have looked at this, there's all sorts of data on what makes cycling safe. A dedicated cycle lane certainly improves things, especially in Europe. Some of them are actually colored to distinguish. One of them is colored red, and I asked when I was in Belgium what that was all about, and I was told that's the tourist's blood, cycle tourist blood. But things like that can improve the safety, but part of it is, a good part of it is education on both parts, to follow the rules of the road. Although you'll find in places like Idaho that cyclists don't have to stop if the intersection is totally clear. That's fine. Cars obviously do. There's a whole raft of things that cycling communities have taken on to make cycling easier. When you do that, you get people out of their cars and they start to go to work on their bikes.
Thank you. Any other comments, questions? Anybody in the crowd? Did you have your hand up? I'm sorry. Yeah, please come forward. That's what this is for.
Thank you.
Your name and where you're from?
My name is Jane Waite, and I'm here to say something for the Oceanside Track and Field.
Yes?
But as it happens, it also relates to the doctor thing because I'm married to one. And I'd like to, they kind of come together. I think if you remember, Dr. Vanderwade started at Oceanside Health Center, and it didn't work out for her. And that was because I think it was just all too much, and she's now working at palliative care. And I think that the funding might be cut for that. So I think we need to look after the physicians that we have here so that they don't leave and that they feel, that they can work comfortably here. So we need to look after our own. And then with regards to the track, I'm a coach, and I have 5 kids and one of them is actually in second year at university hoping to be a physician. We'll see about that. But I'm just tired of the condition of the track, and I'm saddened at the lack of interest that seems to be in this community for sports, for our youth in the community. We want to keep them active and not. There's quite a lot of issues with drugs, and I want to keep them off out of that. Yeah. So I presented as a delegation for the track at the city and at the Rec Commission, and I understand that the track was included in the Sportplex, but I'm not clear as to why it's been sort of shoved under the mat. I think it was, maybe somebody could enlighten me on that, but I think it was incorporated into the Sportplex, and that's been defeated. I'm not sure, but maybe you could enlighten me.
No, defeated is probably a bad choice of words on this one. What we've asked is to defer it, okay, for the Sportsplex and the track, only until we established what Parksville's going to go with theirs. It would be crazy to start planning in this direction and then find out Parksville's going to take it in another direction. So what we've asked is for some time so that we can evaluate where we are as a community, because we think it's very important for our community to have that track, to have the Sportsplex, to have a swimming pool, to have all those things that everybody that has talked to us has certainly told us. It was worth this 6 months to a 1-year delay in order to get this right. What we didn't want to do is ask the RDN to go out and spend all their money on their engineering costs and so on, and not be able to honestly tell them that that's where we're going to go with it. So that's where we're at with it right now, and we're working on it. We're having conversations in behind, and that when our business plan is prepared, that will be part of our business plan.
Is it likely to end up at Bolinas?
I would be lying to you at this point in time if I told you any particular place. We haven't got that far yet. We're just doing it. Yes.
Just a question of delegation, or to yourself through the mayor here. When you speak about Bolinas, I'm curious to know what your thoughts are, if that's something you'd like to see or something that you don't want to see there. And part of the reason why I ask is in the past I've heard about the track being asked for as being 8 lanes, and from my understanding they can only accommodate 6 lanes at Bolinas. Is that a roadblock, or is that something that takes it off the table then?
I have a lot of things to say about that, but if you want to have a sanctioned meet, it has to be 8 lanes. So if we want to run tournaments and to create any monies from it, it would have to be 8 lanes. There is room at Bolinas for it to be 8 lanes. It can go horizontally or vertically to the school. We had an engineer come and do an assessment on it, but it would cost more money. The benefits to having it at the school is that there's 4,000 kids there every day, and it services all the schools in all the districts. There is no other track. The closest track is Nanaimo. So it would be advantageous to have an 8-lane track, and if you're going to do it, you should do it right. That's my thought. However, we would be happy with anything. I mean, a 4-lane track would be fine for the kids to train on. Right now, the only rubberized bit of track we have is 25-meter run up to the long jump, which is where the kids use their starting block and practice one at a time.
so with that in mind too, with the Blenus, it's not just our decision at that point, then that's a school board that has to have the buy-in there as well, so.
I understand that it's a political quagmire, which I've waded into at times, and
It's on our agenda for tomorrow afternoon, if I'm not mistaken, to discuss that. So we'll know more tomorrow as to where the board's thinking is on it.
great. Well, I'm hopeful that the elementary school track meet will go on as it does every year, where all the elementary schools come together in the community, and I think that's really important for our community.
I do too.
Forward.
Thank you.
Okay.
Doug? Councillor O'Brien?
And through the mayor, and thanks very much for your opinion, is very valued, and we appreciate the fact that you're coaching, and so you have a better insight than maybe we do, but rest assured that we are looking at it, and it has been a political quagmire, but the thing is, I think we're getting closer to clearing up that quagmire. I also want to point out the fact that you were mentioning about the youth in our community and so forth, and, keeping them, keeping them out of the drug scene and all the rest of it, and that is a very high priority, and I want to justify the fact that perhaps we've gone after the low-hanging fruit here, but the thing is that if you look at right now in the community park, there's a beach volleyball effort goes on down there right now. In fact, it is tonight. And you'll probably see an excess of 140 individuals down there playing beach volleyball, and of all ages. And that's not just the youth, that's right through even old guys like me. But the thing is that they're down there right now, and they said that we have great amenities for them type of thing, and they want to continue that. As well as that, we also have a huge demand that came at us for pickleball courts. And which is another great thing, and that's another one that's been introduced to the area type of thing, and we have approved in our budget anyways for an extension to the pickleball courts in the area as well. As to say, that those are easy ones, they're low-hanging fruit, but we have addressed the fact that there's a large group of individuals that are looking at that because we appreciate the fact of recreation. Track and field is one of my favorites as well, so it's not far behind, but we're not going to forget you. But just let you know that we are doing our best to keep the youth active in our area, as well as all the rest of our seniors and individuals of all ages, because we know the importance of it. Thanks.
I'm going to put a question to you, if I could. Would you be interested in helping us, at least in the preliminary discussions? Because we always need somebody that knows what they're talking about, contrary to most of us around this table. So, we would love to have you sit in with us for one discussion on the track somewhere in Parksville and see if it makes any sense at all. And if you are, then all you have to do is tell one of these ladies over here your name and address, or your name and phone number and your email address, and we'll get in touch with you, I promise you.
Absolutely.
Okay, thank you. Thank you very much. Anything else? I see a hand back there. Go ahead. Come on up. Your name and your address, please.
My address. Hi, I'm Olivia Hill. I'm a teacher at Bolinas. I will, elaborate on Jane's, points about the need for youth recreation facilities in the area. I think especially as a preventative measure to keep them healthy, reduce the number of diseases they battle later in life, and to keep them or encourage them to make positive choices with their recreational time. I actually took some students to the BC budget consultation in Campbell River this year, and they chose 5 avenues that they wished to see the provincial government invest in. One was actually addressing the doctor shortage locally, so the youth are actually recognizing those as issues for themselves and their future as well. Another one was the need for more recreational facilities in Parksville. As a coach at the school, I coach the girls' rugby team. I can speak to the fact that our field is used by a wide variety of sports. I would say that poses a problem to athlete safety. In one respect, we have track and field that's practicing at the same time, and we're competing for field space, and we're cautious that javelins being thrown over there. We've got sprinters practicing over here. And in terms of the lining of the field as well, we share our field already with Oceanside Minor Football. So we have football lines, we have soccer lines, we have rugby lines, and in contact sports that poses a huge risk to the athletes who aren't aware of field space, where the boundaries are. So it is a nightmare right now, and we're doing our best to encourage students to be active because we know that sets them up for a myriad of benefits in their future. However, I'm just speaking on behalf of the kids. They are recognizing the lack of recreational facilities here, I'm recognizing that I'm putting their safety at risk by competing with other sports for field space, and I would love to see investments in that local recreational facilities.
Thank you very much. We appreciate your comments. We really do. I may ask you for your name and address and as well. So that's the problem with making comments here. You may get volunteered. Yes, of course. Councillor Patterson has a question.
Thank you so much, Olivia. It's always a pleasure and to hear you advocate for the youth and everything in our community. Can I ask where you grew up?
Nanaimo.
Yeah. And you're here in our community, like not very far away, and I love that. As a parent, and that, you know, I have a 26 and 24-year-old that I'm very, 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 very fortunate that they were able to stay in this community. And that's what I hope for our youth, that they're able to stay in our community. So, thank you.
Thank you. Through the mayor. Olivia, can you tell me, is there room to expand for other tracks and whatnot?
Well, the track is currently around our main field, and there's been discussions about resurfacing our secondary field, which is a bit lower in elevation, I think on the north side, and that hasn't happened yet. But I think not only do the lines pose a safety risk, but also I don't know how to describe it, but just the quality of the turf. Like our soccer teams feel like sometimes that field gets so beat up with rugby and football that they can't practice there because the level of field isn't adequate. So they rent out the indoor field in a noose there. So certainly there's more room to have more sports on the secondary field if it was resurfaced, and I think that's in the works, but I still don't think it's sufficient. And I send some of my students to Nanaimo, back to my hometown, to play club sports because there's access to more field space there. So club rugby runs through the spring, through the fall. And I don't think we have the programs here because we don't have the facilities to support them, whether it be our school during the summertime. Even though the school field can be used, we don't have change rooms. It would be wonderful to have a facility where there's change rooms, access to store medical equipment in terms of first aid, bathrooms, water, and those services are missing from the Bolinas field right now for outside of school use.
Can I ask you a question, Olivia, please, if I may? How much of an issue would it be if it wasn't at some of these fields, or some of the track, for example, wasn't at the high school?
Yeah, I don't feel totally comfortable answering that because I'm not part of the track community. I know we have a huge track and field program at Bolinas, thanks to some very dedicated teachers and volunteers. So we have a big contingent of track athletes. So it's nice for the proximity, but I'm not involved enough with track and field to answer that. Yeah, thanks.
Aha, another hand. It's all from the same spot. It's great. It's your birthday today. Oh, well, happy birthday.
You want us to sing for you? No, it's fine. Rotary sang for me this morning.
Thank you for that.
Yeah. Elaine Young, I'm from Parksville. And in the interest of full disclosure, I'm the Rotary Interact sponsor at Bolinas, and I'm also a sitting school trustee and a member, a member of the disbanded District Recreation Commission. I'm trying to de-strand everything because you're meeting with the board tomorrow. So I'll try and keep my comments to recreation. As an individual, I'm a walker. I've lost over 100 pounds since I moved to this community by walking, by biking, and by swimming. I don't swim anymore because the pool's too crowded when I go to swim. That's why I got interested in the Rec Commission. I was also interested in the Rec Commission because I'm interested in trails, I'm interested in cycling, and I'm trained as a cyclist. So I was sat on District Rec for 2 years. We heard all of these people. We heard from the running people, We heard from the pool people. We did the studies. I went to the commission meeting last week, and Parksville voted against the recommendations that came from staff. I was actually embarrassed because the mayor said that he hadn't had time to read his package. The package, a lot of the package has been out for years. We've done all the studies. You're hearing the results of some of those studies today. We need to have a track interim at Bolinas. It won't be a great track, but it'll be a good track. And I can tell you from being in other communities and looking at their tracks that they're not used primarily by kids. They're used by people my age who are rehabbing from injury. They're used by walkers, and they're used all times, day and night. So when you think about those of us who are a little bit longer in the tooth, think about tracks and think about surfaces that we can walk on. The Raven Song Pool, thank you to the commission, is going to be acted upon. That 25-meter increase is not going to be the answer to our question. The answer to our question is looking out further in our needs and going ahead with a multiplex somewhere in Oceanside. I don't feel comfortable as a resident of Parksville and a taxpayer in Parksville to pay for a pool here when it's going to be used by the whole RDN. I used to live on Gabriola, and if we went to the Nanaimo pool and told them we lived on Gabriola, they wouldn't allow us admission because we voted against the pool way back in Coon's age. It doesn't work. You know, people on Gabriola knew, well, you just don't give your address on Gabriola. You use somebody's address in Nanaimo. Look it up in the telephone book, whatever. So I think that RDN resources need to be used for the projects that support all Oceanside. And I'm pretty appalled that Parksville is the reason that none of those recommendations, or that those recommendations didn't go forward. We'll talk tomorrow about the Bolinas track. You've heard from Olivia about her, I don't think she told you that her rugby team, her girls' rugby team, has 60 young women on it. 60. Our Interact Club has about the same number of participants. There are kids there that are doing amazing work, and we need to step up to the plate as a community and say, hey guys, okay, we can provide this. So that's my statement for today. As a cyclist, yeah, I'd like to see more cycling paths, more cycling trails, more education for drivers. I don't like stopping when I'm cycling. It's much harder to start. And just for your information, out of the people in my bike group, there's about, I would say, 10 women in my bike group. 8 of them have electric bikes and they're older than me. I'm one of the 2 people that's on a regular standard bike. And I'm 67 today. So thank you.
Congratulations. Any questions? Now, just to make a point abundantly clear, the stack was that high of information, and we were given it 2 days. It was Wednesday, and the meeting was 2 days later.
And you knew that the meeting was coming up, sir?
No.
You make time for it.
Thank you for your comments.
Yeah.
All right. That brings us in with 1 minute to spare. Thank you, everybody. You did a great job in the timing of this. Any last comments from anybody before we go? All right. Thanks again. This is all going to be gathered up, accumulated. We will have 2 or 3 more meetings between staff and council, and then sometime towards the end of July, we will come up with our business plan that will address all of these things, at least begin the addressing of all of them. We don't expect to have all the answers, but we should have some. And we are setting our priorities so that we can accomplish something. on this as a council. So thank you very, very much for your time. We appreciate it. We're going to take a break now for 45 minutes, and then we will go to, yes, I will get there. We will then go to our regular council meeting. So I need a motion to adjourn. Councillor Greer, seconded by Councillor O'Brien. All those in favor? Carried. Thank you. So what happened?